Deby Adifa Putri, you can call me Deby. I will explain you about my presentation about neoplasm. First, we must know what is neoplasm. From this name is a neo is mean new. So if we want to look a cancer when the cell is just growth under control and they just take over, and they will be benignant and malignant. So the definition of in according on neoplasm from wheels is an abnormal tissue mass with excess cell growth and not coordinated with normal tissue. As we know, neoplasm divide into two basic clinical behavior, namely benignant and malignant. This benignant and malignant neoplasm has two components, namely parenchyma and stroma. There's a predisposition factor. There's 3 age, hereditary, and virus. Age, as we know, the increasing age of a person, there is a greater risk of developing of the cancer. So there's high risk from the old age. There will be able because they have a mutasomic accumulation associated with emergency of a malignant neoplasm and the desecrated immune system in the old age. Hereditary, as we know, there's from parents who have a history of cancer. The virus can also cause a malignant tumor. In humans, they are called oncogenic virus. So we can discuss about a benignant and malignant. So the benignant tumor is a differentiation. So they can differentiation, but they cannot control cell proliferation. They grow too slowly, surrounded by a fibrous capsule. They cannot invite and metastasis, but can damage nearby organs by compressing them. They can damage, but they are also growth and can be large. Different with malignant, the malignant do not perform normal function of the tissue. They can compress or destroy the surrounding tissue. Stage of carcinogenesis. There is three stage. First stage is initiation. Initiation is initial mutation. So the cell is start to mutation and damage to DNA occur. So second stage is promotion. Promotion is a mutate cell are stimulated to divide. There's unregulated acceleration growth. The third stage is progression. There's tumor cells compete with one another and develop more mutation which make them more aggressive. So next we will discuss about a metastasis. Metastasis is a cell in a primary tumor lost addition and develop the ability to escape, travel, and survive to develop a secondary tumor. So the primary tumor becomes secondary tumor. So the metastasis takes place via blood and lymph. To describe you about the metastasis, this is a primary tumor and there's escape, and the cell must die, but they don't, and they will escape to somewhere else and take angiogenesis for her life, for their life. So there is a secondary tumor. To handle a case of neoplasm, we can make a treatment plan like surgery or radiotherapy. We can use two of them. As usually, benignant use surgery and malignant use radiotherapy. I think it's enough about my presentation.